Good afternoon, and thank you for joining us for today's webinar, The Opportunities and Challenges Facing Federally Qualified Health Centers. But as most of you know, that is FQHCs, as we all spout that off as we move forward. My name is Janice Snyder, Partner and Director of Assurance Services. And I'm here today with Kady Fowler, a manager at McKonly Asbury. And both of us specialize in serving many of our healthcare entities. And Kady is a leader in our healthcare practice. And we also have the privilege of working with all the firm's FQHC clients. For those of you who don't know, McKonly Asbury is an accounting and business advisory services firm with offices in Camp Hill, Lancaster, and Bloomsburg, Pennsylvania. We provide a range of services to organizations across a variety of industries listed here on your screen. And if you want to learn more about any of those, please visit our website. If you've joined us on past webinars, welcome back. If you haven't, please join our monthly webinars, which feature various business topics. This month focuses on healthcare. And subscribe to our blog articles so you can see what's going on in all of those industries. So to get to the main event today, I am very excited to welcome Julie Korick to the webinar. I have known Julie for over 10 years and have had the opportunity to work with her in the past in her role at FQHCs. You can see Julie's bio there, but she comes to us from the Pennsylvania Association of Community Health Centers. We had the opportunity to attend their conference in the past. We greatly enjoyed that last fall, so thank you, Julie. She is the Chief Operations and Financial Officer for the organization, and she's going to share all kinds of insights with us today. So welcome, Julie. We can't thank you enough for being here.
Thank you, Janice, and hi, Kady. Thank you for having me today. It truly is a real honor after working in 3 different health centers to be at the association and to work with so many health centers doing such good work in their communities. It's just amazing.
Great, thank you, Julie. I'm looking forward to our discussion today. So before we get into that, we start with our first polling question. So we are going to have 4 polling questions today. We need you to answer all 4 of those questions. So in order to make sure all the individuals that want it, we know not everyone wants CPE, but anyone that wants it, please answer the question here if you wish to receive CPE for attending today's webinar. Also, while you're answering that question, please use the chat function in the software. You can talk to us, you can ask us questions. This is an interactive dialogue. We want to hear from you. That will make it even more meaningful. You got about 3 more seconds to answer this question if you do want those CPE. So great, most of you do, so that's great news. We must be hitting all those CPAs out there in a reporting year, but we think you'll also find a lot of these perspectives helpful as you're talking to some auditors and the Pennsylvania Association of Community Health Centers. And Julie's been in that role before on the other side of the audit with the health centers, so we're grateful for that. So opportunities and challenges facing FQHCs. All right, Julie, I'm going to turn it over to you to talk to us about the Pennsylvania Association of Community Health Centers, their role, a little bit of background there, and just get us started.
And as you can see, we go by PAC. So instead of saying the whole Pennsylvania Association of Community Health Centers, you'll hear me say PAC a lot. And just to know that there's one of us in every state. So HRSA, the Health Resources and Services Administration, they grant fund a primary care association in every state to help with the FQHCs in that state. You know, our mission here really is to support the equitable quality health care that the health centers are providing. A lot of what we do here is to support the health centers in different ways. We do a lot of training events. We do advocacy both at the state and federal level. We do a lot of technical assistance. So there's all types of questions related to the FQHCs, the compliance that they must follow. Another example of technical assistance is Medicaid reimbursement. A large population of the health centers is Medicaid, and fortunately we have a good relationship with the state Medicaid office. So we help in that area as well. The next slide, Janice, please.
Sure, thanks, Julie.
On this slide, you can see some of the data, And it's really nice to see that we have surpassed the 1 million patients served in the prior year. So that's kudos to all the health centers out there doing the good work. We do currently have 51 health centers in PA with about 395 sites throughout the Commonwealth, serving 53 of the 67 counties. A lot of the health centers are moving towards integrated care. We're just shy of 100% of the health centers having dental and behavioral health. Throughout the health centers, there's an upward trend in Medicaid-assisted treatment and vision services. And again, really, the health centers are, want to be a one-stop shop for healthcare and also to be the medical home for our most vulnerable communities.
And I know, Julie, we're seeing that as well, a lot of expansion of those services. We saw a lot of dental and primary care, but moving into other areas, that certainly seems to be a trend.
It is, definitely.
Great.
And then here's just the national outlook, where every state has a primary care association. HRSA also funds the National Association of Community Health Centers. And there you can see that over 30 million people are served throughout the country by an FQHC. There's more than 1,400 FQHCs in the country with over 15,000 clinical sites. So we here in Pennsylvania are also part of a larger movement.
Julie, you've mentioned HRSA a few times. I know that HRSA funding that the FQHCs receive are a lot of the reasons why the FQHCs need a single audit, which we're usually there performing to make sure they're using those funds appropriately. But I think to all of them that HRSA funding is really vital.
Most certainly, even before COVID, there was HRSA funding. With COVID, a whole bunch of additional HRSA funding. So you're right.
Great. We'll certainly have some time to talk about that today. So I think that overview of the landscape is really helpful. And you said in Pennsylvania, there's 51 FQHCs. I believe the PAC works with all of them. Is that correct?
We do.
Excellent.
We have 100% memberships, which is very nice.
That's excellent. Thanks, Julie. All right. So I think that brief overview leads us into polling question number 2. So we obviously have the list of who's joining us today, but how about you share with each other what type of organization you're representing today? Are you in Pennsylvania, outside of Pennsylvania? We saw some other healthcare providers that signed up and are on the list. Maybe you work with FQHCs or want to learn a little more about them. There's some accountants like Kady and I, maybe some government entities or other consultants. So let us know who you are. Probably have about 10 more seconds to respond to this polling question. We certainly want to make sure you have the opportunity to do so, and then we'll touch base for a moment on who's on the call. Excellent. So we have 28% FQHCs in Pennsylvania, some other healthcare providers, but 39% accountants. So some of that might be McKonly and Asbury, some of our team wanting to hear what Julie has to say. So I know I'm excited about that. So that's certainly a good thing. You're excited too, right, Kady?
Oh, yeah.
Great. Thank you. All right, Julie, we're moving into our first discussion question. So I know that I have a child that is on Medicaid with special needs, and we've gone through this renewal process in July. I was always used to April. It got moved. It's kind of messy a little bit right now. You also said you guys work really closely with Medicaid and have a lot of wonderful relationships there. So tell us where this process is. I think a lot of it started to happen in July, at least it did for me, and what FQHC should be doing to support their patients in that process.
Yeah, so the process is being rolled out over 12 months. The state is going to do the redeterminations, the renewals over a 12-month period. So that's probably what you're experiencing. DHS does have a lot of good information on their website. Just this week, they added some new materials for the unwinding, things like text for social media and newsletters. there's tools on there that you can utilize with your patients to help inform them that this is happening, because we all know if they don't renew, they're going to be uninsured. And, our goal is to make sure our health center patients have coverage. And a couple numbers, in May of 2023, there was 254,000 people up for renewals. Around 100,000 did renew successfully. And then it's important to note that the state is also referring folks who don't qualify anymore for Medicaid to Penny, the state marketplace insurance. So about 29,000 patients in May were transferred to the Penny marketplace insurance. Here on staff at PAC, Tia Whitaker is the Director of Outreach and Enrollment and works with the enrollment assisters throughout the state. So there's a lot of work being done around the unwinding.
So, Julie, we certainly know that FQHCs want insured patients, but just the population in general with the mission, we want individuals to have health insurance and to have good coverage. But you had just said 254,000 were up for renewal and only 100,000 renewed and 29,000 were moved, into the other bucket, into Penny. What is that? That leaves the other half. Are they not renewing, becoming uninsured? This could quickly turn into a crisis.
And that is the concern. That truly is the concern. And that's why DHS is putting out a lot of resources that community organizations can also help get the message out and also assist these consumers. Not everyone has access to computers and things that they need. So if we can help with the state with the effort, that's the goal.
So you certainly believe it's access and I would think education. I try to be on top of this and, for a little while I was going, what's going on here? So I work in it, I live it with my child and we go through this process and it wasn't clear to me. So I imagine there's a lot of people that are in that situation as well.
Yeah, unfortunately, HRSA has given the PCA some additional dollars here recently for outreach and enrollment. And next week, we are launching a campaign. We developed some marketing materials that the health centers can customize, all related to this effort. And I had mentioned Tia, our Director of Outreach and Enrollment, she's going to launch the campaign next week on the 26th during the normal monthly meeting of the Outreach and Enrollment Assisters. So there's more materials that'll be shared with the communities.
But I think what I'm hearing, that the FQHCs really need to be in front of this, making sure people renew, making sure they get insured. When individuals come in, can they help them with that process, or is that just not something the FQHCs would be equipped to do?
They're allowed to share what information is available and where to get the information. And then, of course, the enrollment assisters can help with enrollment of marketplace insurance, Medicaid, even Medicare.
Okay, great. So there's resources out there, and we hope that everyone is getting in front of this and assisting those patients and making sure they stay insured. Great. Anything else on this topic, Julie, before we move on to the next one?
Yeah, there is one thing to mention. There's a product out there. It's called FQHC Retrocade Tracking Product. A lot of our health centers are using it, but if you are not, it's a great tool because as we talked here today, the patients who do not renew and then become uninsured, at some point later, they may reapply and be accepted. This product will go back to visits that were originally uninsured when Medicaid is retroactive. So once they're approved and Medicaid is retroactive, you can go back to the uninsured visit you had and resubmit the claim. So if you want any information on FQHC, you can always reach out to us here at PAC. Anyone here can help you. We can get that information out.
Great. I think that would be really helpful for individuals who unfortunately miss this renewal process. Great.
Certainly.
Thanks, Julie. So I know that I've been talking a lot, so I'm going to turn this question over to Kady to lead.
Thanks, Janice. So as everyone in the healthcare industry knows, the past few years during COVID, there was a significant amount of funding provided to healthcare organizations. The Provider Relief Funding, the American Rescue Plan Act, majority of our organizations qualified for both payroll protection program loans, and some even qualified for the employee retention credit. There was also some additional funding sources provided during the COVID timeframe as well, but all in all, this COVID funding is coming to an end, and the healthcare organizations are figuring out how this next year is going to pan out for them. And most are seeing some significant losses that they aren't used to seeing due to not receiving this additional funding. So Julie, I have two questions for you. One, what is next for FQHCs? What are some items that you're seeing that FQHCs are putting into place to help with these losses? And the second question I have, you mentioned some tools and resources already, but what are ways that PAC can help FQHCs eliminate some of these losses?
So when we say the funding is going away, yes, the majority of it is going away, but there's new funding coming. We learned last week from HRSA that there's an additional COVID vaccine activities funding coming out real soon. In total, that's $81 million. But for each health center, that comes out to $63,000. So there is some additional funding coming out here soon. It will be provided in for year 23. It will supplement the current H8G grant, which is the expanded capacity grant. And it will support a slightly broader range of services than the original award. So HRSA has asked that the health centers do not close out their previous ECV award because this new funding is coming. Now, again, that's a small amount of funding compared to what they had received over the pandemic years. So yes, what is next? Some tools that we have tried to provide and help with this effort. Last fall, we were able to, it was grant supported, but we were able to provide trending reports to every health center. And the trending reports showed data that over a 4-year period from 2018 to 2021. So you were able to see data from pre-COVID years and then during COVID years. And the whole purpose of that was to have a tool that the health centers could look at internally and help with strategic planning as they move out of COVID. Those reports showed things like visit volume, expenses, UDS data was on there. We also did a separate billing KPI survey. In the industry, there's not specific FQHC billing KPIs, key performance indicators, to compare to. This was actually an idea from one of our health centers. So we were able to do surveys, whoever wanted to participate, and then that way they could compare to each other instead of other primary care doctors. It was specific to FQHC. So there was a billing KPI survey that happened in 2022 as well.
When it came to that data, Julie, was there anything very shocking that came to light looking at the trends that comes to mind?
Well, of course, the reduction in visits once COVID hit and the increase in telehealth visits after COVID hit. I mean, that's the main thing that we saw.
Yep,
yeah.
Fair. Fair enough. And then with that grant that you mentioned that's replacing the H8E grant, do they have to apply? Do FQHCs have to apply for that, or is it just automatically provided to them?
They do not have to apply. It will be automatically provided to them, and it's going to be one of these awards where the money shows up before you do a budget. So they're going to send you the money, and then they're going to ask you later how you're going to use it.
Another surprise funding hitting your bank.
That was certainly a new thing that we saw early on in COVID, as the healthcare organizations in particular just started having money dropped into their bank accounts, which on the surface is great. It kept cash flowing and it helped a lot of organizations, but tracking down the strings attached and how you were allowed to use that and how you had to prove it, and then we as auditors having to audit to those requirements. There were certainly challenges there, and there were many CFOs I talked to that were like, no, I'm sure somebody applied for that, and we're like, no, probably not. So it sounds like a little bit of that, certainly not to the same degree, but a little bit of that under new programs is going to continue.
Correct.
Yeah.
Make sure we're aware of that. Nobody wants to get blindsided with that, with new audit requirements at the last minute, right? Least of all us, right, Kady? But more importantly, the organizations. Cash is good, but how do we get to keep it? That's equally important.
One thing I just want to keep pointing out as you're listening through the presentation today, Julie has mentioned after each one of our slides, all these resources and tools that PAC can provide to FQHC. So if you haven't already, please feel free to reach out to Julie and her team with any questions that you may have on behalf of your organization.
That is why we're here, Kady. That is the exact reason why we're here.
Excellent.
All right, our next polling question, number 3. What is the biggest challenge you are seeing with FQHCs? Ending of government funding programs from COVID, concerns over 340B legislation and challenges, workforce, technology, and federal and state appropriation fundings are your choices.
We've certainly seen all of these to some degree.
Yeah,
Julie,
they're all pretty important.
Yes, 100%. Julie, in your opinion, what do you think is the biggest challenge that FQHCs are seeing?
I think they're all challenges current up today, but the biggest to me would have to be workforce. We hear it all the time, and really you can't meet the mission. You can't help the patients if you don't have the workforce. So right now that's a huge challenge. We do have a workforce team here at PAC.
3 more seconds. Sorry to interrupt, Julie. Go ahead.
I
don't want anyone to miss it, but go ahead, Julie. Your team. Go ahead, your workforce team.
We do have a workforce team here at PAC, and we were able to add, yes, and they agree, workforce.
The audience agrees.
And the second choice I was going to say was the government funding, the ending of that.
Right.
Okay. Julie, you were starting to talk about workforce and some of the resources you have. Please share that with us.
So we have a relationship with the Department of Health, the PA Primary Career Center, and in the past it was largely geared towards dentists, clinicians, physicians. In the past year and a half, we were able to add another staff member, and that staff member is focused on frontline staff, your medical assistants, your dental assistants, your front office. So we're trying to address the workforce in different areas now, really, because it's really needed.
Are there, while we're on that topic for a moment, are there any creative solutions to that, or anything you said, wow, that's a really good idea? I mean, everyone would love to pay more, but looking at different benefits, culture, there is limited funding, as we've already said.
Well, fortunately, with some of the federal stimulus money that came through the state and vaccine hesitancy projects, one of those projects is working with community health workers and medical assistants and getting them trained. So there's some funding available right now to many of our health centers to be able to, you might have had that medical assistant who needs some extra training to get a certification. Well, the funds can be used for that, and also with community health workers. So where we could, with different funding that came down the line, we tried to use it in a useful way. So that's just one of the projects happening.
Great, and some of those funds are still available? Is that an opportunity for some of the FQHCs?
Well, they're already allocated. The projects run through June of 2024.
Okay, great. Thanks, Julie. All right, we could talk about this slide probably all day, but I'll let Kady move on to the next question.
Our next question, what are some of the more significant topics at the federal and state level that will impact FQHCs in the future? So Julie, 2 major topics come to my mind. one, the 340B program, and two, the 2016 state reconciliation process. For those on the call that aren't aware of what we mean by the 2016 state reconciliation process, so in 2016, the Department of Human Services changed the prospective payment system process, known as PPS rate, so that this payment could be paid out by the MCOs rather than the state to have this responsibility. DHS still ended up providing an advancement to FQHCs until the MCOs were able to process and pay the correct PPS rate. But all in all, this led to the state performing reconciliations between what the state paid versus what the MCOs paid. And this is still in process after all of these years. So that's a lot of information. But Julie, let's start with the 340B program. Can you talk about what you are seeing at the state and federal level in regards to this program?
There's a lot of activity going on the 340B program because a lot of the drug manufacturers are restricting the contract pharmacies and their ability to use the drugs. So there's federal advocacy happening on a national level, and of course the PCAs, each PCA is working with NAC on that, and it's really to try to minimize the manufacturer restrictions on contract pharmacies. Here at the state level, we are working with the state. There's a work group that has been set up with covered entities, not just FQHCs, but covered entities throughout the state with the state to prevent duplicate discounts. So there's work being done on preventing duplicate discounts. There's advocacy being done to reduce, like I said, the restrictions on contract pharmacies. And I know we were talking earlier, Janice, how Pennsylvania has urban and rural throughout the state, a lot of rural, a lot of urban. You know, for some of our locations, there's not many options for contract pharmacies. So when they limit the options, we're reducing the ability of people in need getting their scripts.
You're absolutely right. And we hear a lot about how do you prove and know you're not taking those duplicate discounts? Like that can get a little tricky for some of the FQHCs out there. So I don't know if you have any advice on that, Julie.
Well, it's really tricky and detailed. And, you know, the federal government does have a Medicaid exclusion file, which does work, but it doesn't work for the contract pharmacies because when you're billing under a contract pharmacy, you're using that pharmacy's MPI, not the NPI of the health center on the Medicaid exclusion file. So again, it can get very sticky. There's a lot of details, but that's the reason for the work group is really to find a way that we can assure that the state's not claiming the rebate and the covered entity is not claiming the discount.
Mm-hmm. Yeah, certainly I know the 340B programs are vital to a lot of organizations and that they tend to create cash flow to help fund other areas of the organization, and that's really helpful. But there are a lot of details in that to make sure that you're accounting for that properly and not taking duplicate discounts and things like that.
Right, and it offsets the cost of the uninsured scripts and their ability to get their medications. And so, Kady, you brought up the 2016 cost report.
I did.
No, we're done. I wish we were done talking about that.
Well, I can tell you there's a lot of frustration. There's a lot of frustration among the health centers on the 2016 cost report and the outstanding issues. But what the state has done, they are currently in their second round of audits. So the state has already audited 3 health centers for the 2016 time period. They are now auditing 3 more health centers for that time period. So that's only 6 health centers at this point that have been going through audit for 2016. They do, you know, the state has said that they plan to audit all the cost reports where there's money due back to the state. And as Kady mentioned, the state was really just providing that cash flow in the beginning so that there was cash flow and there wasn't a disruption. And so, like, the goal was, once the MCOs can accept your claims, you are supposed to get the money retro back and then pay the state back. So the money really is due to the state, and they're just very slow about getting the audits done.
Very slow.
Okay. I know COVID probably messed that up too, but in the 3 audits that they've done, or the next 3 that are in process, is the state recouping that money? Is the money coming back as they expected? And was there any rhyme or reason? Did they start with the larger repayments, or did they just start sort of haphazardly?
No, I think they did start with I think they did start with some of the larger amounts, and there was some repayment, because quite frankly, if you're showing money due, it's because you did get money from the state and the MCOs at some point. And when you got that money from the MCOs, then you need to pay it back to the state. So there has been payback. The state was saying, we want to get through these audits and find some trends. They really didn't find any trends in that first round, like from the first Health Center to the second to the third. We had asked if there were certain trends because that's what they were looking for, but not yet.
To my knowledge, Julian, correct me if I'm wrong, but it took a while for these MCOs to get on the same page and to be able to process the correct PPS rate. So to my understanding, this just didn't happen in 2016. It also kind of flowed into like 2017 and 2018 timeframe. Do you think, and maybe you don't have the knowledge of this, but do you think they'll do the same process for the 2017 and 2018 reconciliations?
It seems that they will. We have heard from the state that if you're showing a cost report where there's no money due back to the state, that you would not receive an audit. So they really are looking at the cost reports where it's still showing money due back to the state. But there's nothing official yet on 2017, 2018. I just know that they want to recoup their funds.
Well, everybody wants to recoup their funds, whatever they any other topic, or moving on, if that's okay, are we done with the 2016 reconciliation process, or do you want to talk a little bit more about it?
We can move on. No, we can move on.
Perfect. Is there any other topics that you want to mention that our FQHC should be aware of as far as the state and federal level comes to mind?
There is one item. It's a good item. It's good news item at the state level. So for Medicaid, LARCs, they're long-acting reversible contraception, and they're things like IUDs for women contraception. They're very expensive. The cost of these LARCs are higher than most health centers' PPS rate, and it was a real challenge for many health centers to even provide that form of birth control because of the cost. The state, they are working on a state plan amendment, and they're going to start paying for those LARCs in addition to your PPS rate. So you'll get your PPS rate for the visit, and you'll get a reimbursement on top of that for the LARCs. So it's a good win. It's a good win for that reimbursement, and we're looking forward to that. We thought it would be ready in the spring, but they've submitted that with other items in their state plan amendment. So hoping to have a bulletin here in the late summer, fall. And the state that when the bulletin comes out, that's when it'll be effective. It's not going to be retro.
Well, some additional funding and being able to offer those services is a really good thing. So, and it's good to have some positive news.
Yes, yes.
And you said that's going to be addition to the PPS rate, so it's going to be an additional reimbursement. It's not going to be tacked on to the PPS rate?
Correct. The caveat there is that you're not including the cost of the LARCs in your cost report when you develop the PPS rate. And as you know, there's limited times where you can open up the cost report to change your PPS rate.
Yep.
So many health centers don't have the cost of that in their cost reports, but if you do, then you would have to have your PPS rate adjusted, to get the payment above the PPS rate.
Yeah, I know. Isn't Pennsylvania unique in that we can only get your rates changed and filing cost reports to get your PPS rates changed when you're offering new services or there's a significant change?
Yes. I mean, it's only if you add a service or delete a service.
Yep.
those two things are what triggers a change in scope to open up your PPS rate.
Yep.
So it's very limited.
So some organizations can be stuck with very old rates, correct? Like old PPS
Correct.
rates. In a position that they're not able to change them unless they find a new service.
Correct.
Or a change. All right. Anything else here, Kady?
I don't have anything else. Julie, anything else you would like to share? Any more good news?
We might only get one of those a webinar.
Maybe later. We'll see what happens later. We'll see if there's more good news.
All right, I'll move us on.
All right, our next question. So what are some of the major initiatives that FQHCs are focusing on for the future? So we mentioned we're aware of some of the things we mentioned. Janice mentioned about the expanding their services, and I know some are focusing on new pharmacy locations. Julie, are there any other initiatives that you're seeing FQHCs focusing on?
You know, there's a lot of work being done around team-based care. There's a lot of work being done between primary care and behavioral health integration. We see an increase of community health workers. More and more health centers are purchasing mobile units to get out and meet the patients where they are. So there's a lot of work around that. You know, the team-based care really is the basis to move into value-based care. And so here's the other good news, Kady and Janice.
Here we go.
Just yesterday, we received confirmation that we have enough participation and that there is going to be an all PA FQHC ACO in the Medicare Shared Savings Program. So we were excited yesterday that there's going to be an FQHC ACO starting January 2024 in the Medicare Savings Program. And we have 20 health centers involved in that project right now. It's not too late, but it's almost too late if you want to join, because August 1st is the hard deadline for CMS. But very excited to get this started. You know, we do have 51 health centers, and they're all at different spots in the continuum of where they're at on value-based care. But this opportunity really is a no-risk opportunity to get in, get your feet wet, learn more about value-based care, and then, you know, from there, new programs can happen, and you could work with other insurance payers down the line. So yeah, we're excited about that one.
And that was a huge milestone, right, Julie? What are the numbers you needed to hit for Medicare lives to reach that?
I think we needed at least 10,000 Medicare lives.
Excellent.
Yes.
Wonderful. And a little bit with the value of that Medicare ACO to the FQHCs. Can you talk a little bit more about that? I'm jumping in there, Kady. I know you got other questions too.
The value is really to set up your processes to improve the quality of care of patients. You know, value-based care really is moving from being paid based on number of visits to being paid based on the quality of care. So are the patients improving in their metrics? Are they improving in their quality of care? So this program will help the health centers set up processes internally to work on quality care. And it, like I said, there's no downside risk, but if there were to be some savings after the year is over, that will be shared among the participating health centers. So there's potential revenue to be had. And again, this is a low risk way to do that.
That's great. Thanks, Julie.
Sorry, Janice. You mentioned that like 20 of the health centers are participating, but the deadline, if they other health centers want to jump onto this, that August 1st is the deadline. But if they miss that, do they have an opportunity to join in future time frame?
Yes, they definitely have opportunities to join in future time frames. You're correct. If you do miss this deadline, and other opportunities too. There might be other value-based opportunities with other payers.
Yeah. Again, another source that PAC can give to our FQHCs, which is awesome.
Yeah, thanks, Julie. I was going to ask you, talked about the mobile units, and I thought of that. I've seen some of the mobile units in the more urban areas, but I just thought, wow, this could be really beneficial in the rural areas when you have to go out further. And I know access to care is a struggle in both locations, but you kind of look across the landscape of the state, there's a lot of rural as well. Are you seeing that in rural areas as well as the more urban areas?
We're seeing it in both areas. You know, there was a challenge early on, and I think some of them may be facing it with the supply shortages. It was taking months to even get a mobile unit. So there's been a delay for some of the health centers on doing that work.
Okay, great. And my last question on this, Kady, you talked a little bit about the team-based care, bringing primary and behavioral health together, and you talked about value-based care. And what's a little bit of the distinction in there? Is there some overlap or a lot of just those terms?
I think the overlap is both value-based care and integration is about improving the quality of care for the patient, and it's about improving the outcomes of the patient. Both models work to do that.
Okay, great. And I would think that's just not an FQHC concept, but one we're definitely seeing evolve more in FQHCs as well as other healthcare organizations.
Right, and you know, behavioral health is huge right now. There's a huge need for that, and the health centers, they can either, you know, they can staff psychiatrists, but they can also contract with others to provide that service, even if they're unable to do so in-house. So being creative on how you can have that service for your patients is important.
I know I was a few weeks ago out at an FQHC, and they were showing us like their telehealth rooms where they do behavioral health there, but their psychiatrists could be anywhere. And they're doing some of those via, you know, the virtual visits. But right, for individuals that maybe don't necessarily have technology at home, they were coming to their location and then doing a virtual visit from there. So I don't think I'd seen that before.
And you know, in 2022, Medicare for behavioral health telehealth, they made it permanent. So on the behavioral health side for Medicare, for the FQHCs, they can do telehealth permanently. On the physical side for Medicare telehealth, it's been extended through 12/31/24, but then some legislation needs to happen to make it permanent. So the good news on that front is behavioral health telehealth is permanent with Medicare for the FQHCs.
Great. Any other major initiatives? I mean, we saw before new locations, acquisitions, mergers, things like that, but certainly it continues to evolve.
It does. It does. You don't see a lot of mergers in FQHCs, not that I'm saying it won't happen, and we did have one here in Pennsylvania. So yeah, time will tell, I guess, on that front.
All right. I guess I'll move us forward. So our last polling question. Go ahead, Kady.
Our last point, I would be interested in learning more about FQHCs in one of these areas. The evolution of the 3-4B program moving forward, the sliding fee scale discounts and best practices, future opportunities for funding, investments in technology, the future workforce. The sliding fee scale discounts is a positive to our community, but there is a lot of background information and processes in place that go involved in this situation. I know a lot of our clients have a lot of trainings with their front desk and stuff like that. So in the future, the workforce, as Julie mentioned, is a problem for a lot of our clients and a lot of the FQHCs and healthcare in general.
So I think you have about 10 more seconds, so make sure you answer this, but I think I threw sliding fee scale in here because we know going into an audit that the most likely place you're going to have a concern or an error because of the amount of training required is sliding fee scale discounts, but only the auditors are thinking about that. So obviously with 0% there.
I know.
You surprised, Julie? It's coming back to workforce.
It's coming back to workforce, but the other three are a tie. That's interesting.
Yep.
They are, so.
And sliding fee discounts was 0.
I know.
Everybody understands it.
That's excellent. That's what we want to see.
As your auditor, I'd like to hear that.
Yes, we do. All right. So, oops, I skipped a slide. I'm going a little too fast here. Let me back that up. At least I'm trying to back it up. So I know that slide that we were on was just Julie. We talked about a lot of great things here. Hopefully gave a lot of resources that PAC can provide and ways that they can help individuals on the screen. So here we go. Finally made it back to that screen. So final thoughts or words of wisdom that you want to share with the audience. And audience, this is also your time as you're listening to Julie to submit some questions. So we're going to have a few minutes and the opportunity to answer them. Otherwise, you've got to listen to Kady and I's questions. Go ahead, Julie.
So first, I just want to say that if you do have any questions on anything, you can email pac@pac.org, or you can email me, julie@pac.org. But certainly don't hesitate to reach out. What we always say is if one health center has a question, I'm sure the other health center was asking that same question. And as you know, we try to share information throughout all the health centers once we learn of the information. And then just to put a plug for our peer groups, we have about 12 to 13 peer groups. If you have staff that want to join finance, billing, clinical quality, compliance, HR, there's just 12 to 13 peer groups we have, so you sign your staff up for those. But I do want to say to the health centers, you know, a huge thank you for taking on COVID. It truly was amazing to see how everyone moved to telehealth, but everyone kept their doors open to see the patients. And you know, I really feel like through all of those efforts that FQHCs are no longer the best kept secret. I think we're out there on the forefront. And just to say, you know, it was amazing to watch, and you all do a great job. And I just want you to know that you're not alone. There's other FQHCs in Pennsylvania and nationally. And like I said, if you have a question, just ask.
I think you're absolutely right, Julie, about FQHCs. They were like the best kept secret. They're in all of these communities doing such great work, helping individuals get access to healthcare, helping them get insured, but providing those vital services that no one else is providing. And that's why HRSA helps fund them, but really living out that mission. And you are correct that COVID brought that to light, but I think many FQHCs out there are like, wow, that was challenging. I hope I never see anything like that again.
I agree.
Okay. All right. So we ended here with our live Q&A. So I'm going to say, Kady, in all of these discussions, anything come to mind that you want to ask Julie? I'm still sitting here thinking it's pretty amazing that things change so quickly. Julie, you announced 2 things on this webinar that just happened in the last week. So
yeah, every day something's new. Which is a good thing. Keeps you on your toes. It would be boring if it wasn't like that. One thing that comes to my mind, Julie, is, you know, you talked about how FQHCs come to PAC and ask questions, and, you know, if they ask a question, maybe 5 other health centers are thinking the same exact thing, but they just didn't come to you and ask that particular question. Is there a certain question that has come to you recently that you think that other FQHCs should be aware of? Put you on the spot.
You know, we do a lot of peer queries, and there was recently a peer query on how many MAs to providers. So what's your ratio, the number of MAs to providers? That was a recent peer query, like on our chief operations group. A lot of the responses were 1-to-1, but you did see a couple health centers have 2 MAs to 1 provider. And, you know, I think that as you move to value-based care, you rely on your non-provider staff to help with the process of the patient. So that's one topic that came up recently.
Yep. interesting.
Great. Julie, I know when we were preparing for this webinar, we talked a lot about legislation and advocacy, and that you were down at the Capitol, and it's kind of exciting that a lot of, the healthcare leaders or elected officials now know what FQHCs are. And several years ago, that may not have been the case. So tell us a little bit about your advocacy and the landscape, at the Capitol and, for the state of PA.
A lot of advocacy happens at the local level, and we have a lot of CEOs and other staff at the health centers who do a great job working with their local legislators. And really, they need to hear the stories. They want to hear the stories of the patients in the health centers and how this program works for that patient. It's really, that's what resonates with the legislators. If you can share a story of the why, that's really helpful. Fortunately for, the history of the FQHC program, we have largely had bipartisan support. So typically the funding is reauthorized. We have to advocate for it every cycle. It's not that we don't. You can't just assume it's going to be reauthorized. But history has shown there has been bipartisan support. But the funding is coming up again this fall. So by the end of September, it needs reauthorized. So again, at the local level, if the health centers can reach out to their legislators, that's the most impact. Of course, NAC on the national level, they're advocating for the health centers, as we are at the state level as well.
Great. Thanks, Julie. Julie, I just think we'll wrap it up today with anything else. Anything else you want to share?
Anything else I want to share? I already shared the good news. That's what I wanted to share.
There you go. Great. All right. Well, then I don't see any reasons for lunch. Here's the contact information. You have them in the slide deck for myself. Thank you, Kady, for joining me in this discussion, and very, very much appreciate your time and preparation for this, Julie, and certainly all the expertise and all that PAC does to support the FQHCs and to support legislation and ultimately to support the patients that use all of those services provided by the FQHCs. So thank you, Julie.
Oh, you're welcome. It's been a pleasure to be here, and we do like to share on the FQHCs and the good work they're doing.
Great. So everyone on the webinar, thank you for joining us today. We hope you enjoyed it. We hope you enjoyed the interactive dialogue. We hope that the good news Julie shared affects you. If you have any further questions, please reach out to Julie, reach out to myself or Kady. A recording of today's presentation will be posted on our website and social media in a few days. For those of you that requested CPE on question number 1 and answered all 4 of the questions, you'll have those certificates in about the next 2 weeks. They'll come right to your email. And we're going to wrap it up today as I quickly make a plug for our next webinar, which is on July 27th at 2 o'clock, same time, so 1 week from today. I'll be hosting a manufacturing panel discussion to get feedback from a tax perspective and auditors and financial reporting perspective and an IT perspective and cybersecurity of hot topics and what's going on with our manufacturing clients. So taking a little pivot away from healthcare, but I love both industries and grateful I get to work in both of them. And I hope that any of you that want to will join us for that. And thank you, Julie. Thank you, Kady. Thanks, everyone. Have a great day.